UAB UnitedHealthcare reached tentative deal. What it means for your coverage. A major breakthrough has just been reached that will impact thousands of patients relying on UnitedHealthcare insurance for their medical care at UAB Health System. But here's where it gets controversial. The road to this agreement was anything but smooth, and the underlying issues reveal a deeper conflict between healthcare providers and insurers that affects us all. On July 31, 2025, just moments before their existing contract was set to expire, the University of Alabama at Birmingham, UAB Health System, and UnitedHealthcare announced they had come to a tentative agreement to continue their partnership. This means that patients covered by UnitedHealthcare will still be able to receive care from UAB and its affiliated providers without interruption, a relief for the 1.4 million Alabamians who depend on this network. UAB released a statement at 5 p.m. confirming the deal, emphasizing that the agreement in principle secures ongoing access to medical services. Both parties have agreed to a one-week window to finalize the details, aiming to establish a multi-year contract that promises stability and continued high-quality care for patients throughout the state. UnitedHealthcare, the nation's largest insurance company, echoed this sentiment in a statement to AL.com, confirming the extension of their current contract through August 8th while they work out the long-term terms. This extension ensures that patients won't face any sudden loss of coverage or unexpected medical bills during the negotiation period. However, the path to this agreement was fraught with tension. UAB initially raised concerns last month about the possibility of ending their contract with UnitedHealthcare, warning that if no deal was reached, patients would be responsible for paying out-of-pocket for services. The health system cited several key issues driving the dispute. Reimbursement rates that they described as below market, frequent denials of claims, and delays in payment processing. These challenges are not unique to UAB. Other hospitals nationwide have reported similar conflicts with UnitedHealthcare, highlighting a broader industry struggle over fair compensation and timely payments. UnitedHealthcare fired back, labeling UAB as one of the most expensive academic health systems in the Southeast. The insurer argued that UAB's demands for higher payments would inevitably lead to increased premiums and higher out-of-pocket costs for consumers. This clash underscores a fundamental question. Should insurance companies prioritize controlling costs, or should hospitals be compensated more generously to ensure top-tier care? And who ultimately bears the burden? The patient? This isn't the first time these two giants have faced off. Back in 2019, contract talks also broke down, but were resolved just before the deadline, mirroring the current situation. These recurring standoffs raise important questions about the stability of healthcare networks and the potential risks to patients caught in the middle. What do you think? Should hospitals like UAB push harder for better reimbursement, even if it means higher insurance costs? Or should insurers like UnitedHealthcare focus on keeping premiums low, even if it strains provider relationships? Share your thoughts and experiences in the comments below. This debate affects us all, and your voice matters. Note, if you purchase a product or sign up for UAB Health System and UnitedHealthcare, new insurance agreement explained. In a significant development for healthcare access, the UAB Health System and UnitedHealthcare have successfully negotiated a new insurance agreement. This pivotal contract guarantees that members of UnitedHealthcare will be able to receive medical services from all UAB and its affiliated healthcare providers without any interruptions. This agreement is particularly crucial, as it ensures that patients can continue to receive high-quality care seamlessly. But here's where it gets interesting. Both organizations have set a one-week timeline to finalize the specific terms of this contract. Once the details are ironed out, UAB has indicated that the new agreement will be in effect for multiple years, which promises stability in healthcare access for patients throughout Alabama. UnitedHealthcare has emphasized that this agreement will maintain uninterrupted access to the UAB network, which is vital for many individuals relying on these services. To facilitate this transition, The current contract has been extended until August 8th, allowing both parties the necessary time to finalize the long-term agreement. It's worth noting that the previous health plan contract officially expired on July 31st, 2025. This situation raises important questions about the future of healthcare agreements and their impact on patient care. How do you feel about the negotiations between large healthcare providers and insurance companies? Do you think these agreements truly benefit the patients, or are they more about corporate interests? Share your thoughts in the comments.